Good morning, Dr. Neeraj. I'm calling because I'd like to do an interview with you and consult with you since you're one of the top gastroenterologists in India. I'd like to ask you a few questions about liver problems, alcoholism, things like that. Do you mind giving a few minutes to me?
Yeah, we can do that, yeah.
Okay. Well, number one, I would like to ask you regarding the liver, what are the main diseases which affect our liver? That's my first question.
See, Nancy, the most challenge which we have in maintaining healthy liver is because of the harmful damage of the alcohol, which has now become a fashion over the coming time. And we call it alcoholic liver disease, alcohol-related liver disease. And there are many myths in the society regarding that there can be some safe limit of alcohol, or beer can be beneficial, not harmful as compared to others. So these are all myths. And to my experience, I have been seeing patients of liver disease for last 20 years. And it is very unfortunate that I have seen many young patients who lost their life simply because of the overuse of alcohol, and sometimes that happened on a binge drinking in the weekend, which led to very severe acute pancreatitis. And alcohol-related liver disease is definitely a very strong menace on the society. So these are the real challenges, yes.
Now tell me something, but there are many types of alcoholism and people don't really realize that they may be an alcoholic. Maybe like you said, binge drinkers who drink a lot and then don't drink for a few months. Can you sort of tell me the different types of alcoholism that people may not even be aware of?
Yeah, very right question. So just like any substance is having stages of addiction, similarly here in alcohol addiction, the first person tries the alcohol, that is the occasional use, that is the first stage. Then after that, he is repeatedly using this. This is the second stage. And now a serious thing comes, which is abuse. He starts abusing, and there are health-related side effects, but still he is using alcohol. So he lands into the third phase of abuse. Now the fourth stage is very dangerous, where there is dependence. And now the patient is not getting any pleasure, any benefit from the alcohol, but he is not able to do his routine activity. So he is dependent on alcohol. Now even to get up from the bed, he needs alcohol. So the basic activity are requiring alcohol. That is the fourth very harmful stage, dependence, and from where the reversal becomes very difficult. So it is very important from our part that in the initial two stages, that is the occasional or regular or even abuse, from there, if we are strongly motivating the patient and he abstinence, then we can save the liver.
Gosh, it's very sad because I think alcohol has really become prevalent here in India now. So many liquor stores are opening up and it's very profitable. So more and more and more. I remember coming in '99 and you didn't see that. But now it's just becoming a thing of like the rest of the world. So tell me something else. What's a safe limit of alcohol drinking?
Very good question, Nancy. This is the myth prevailing in our society, and there is certain safe limit and the limit in which alcohol can be beneficial. But these are all myths. Basically, this is one of the favorite questions. Whenever I give talk, this question is asked to me. So according to me, the safe limit of alcohol is zero limit. Why? Because of two reasons. Even if the patient is under the influence of one or two drugs and he's driving a vehicle, he crashes or accident, that safe limit is unsafe for him, number one. And number two, in my clinical experience of last 20 years, I have seen patient expiring of acute pancreatitis in young age, 30 to 40 years of age, and they just took a binge drink in some party. So these two things very clearly, the safe limit of alcohol is the zero limit. There can't be any safe limit of unsafe thing. That is very clear. So safe limit is zero limit.
I agree. And also, after binge drinking and with friends and parties, then what happens? They start drinking alone maybe, or hiding the liquor, just like another type of drug addiction.
Yes.
Where
So
they hide
that's very true. Once this one substance is there, these person tend to be vulnerable to other type of drugs, other unhealthy things they use. So that also makes them very vulnerable.
Wow. Well, so the next, one of the last questions, I probably have a dozen more I could ask you. Commonly, we'll see a patient having fatty liver disease. So what's your opinion on that?
Yes, Nancy. So now what happens in India, now we are seeing many overweight patients and they are obese, they are overweight. So that is one thing, just like fat deposited in other places, fat gets deposited in the liver. We call it non-alcoholic fatty liver disease. And over the years, it causes damage in the liver. So NAFLD or non-alcoholic fatty liver disease is now becoming a common problem in India also, in Asia. And so that leads to slow deterioration in the liver functions, and sometimes patients end in a chronic liver disease. So it's very important for us to detect it early, and by lifestyle changes, we can decrease the body weight and BMI, and then the liver fat also slightly decreases, and it becomes very important to monitor such patients so that their liver is not damaged and they maintain a very healthy lifestyle. That is a very important concern nowadays.
You're just, so many years, you're just so knowledgeable about all of this. But some people, don't they just stop eating and give up everything and just hold that bottle of liquor or beer or whatever it is until it's a sad thing. What are we going to do about it here in India?
Nancy, that's a very good question. And even in my clinical practice, when I see patients who are using alcohol and they are dependent or they are abusing it, so as a doctor, we can advise them abstinence. But now what happens, there's not a strong any hand-holding or any platform which can help them. So that becomes a real challenge. But now, in my experience, we have certain programs, particularly from the Art of Living, we have a wellness program for substance user, in which they are just in a type of follow-up they give to the patients, and they teach some meditation, some motivational exercises, some alternative yogas, and they just follow these patients. It motivates them. And I have seen what we say abstinence in around 50 to 60% of such patients.
Wow.
So this is one thing, wellness program for substance, a very healthy program now available. Even it can be done online now.
Gosh,
so that
is wonderful.
That is
well,
one
maybe
thing.
You can give me the online address or something that people
We will
can go
update
to
that.
later.
We'll keep on updating. And thank you so much for this talk. Will really help many in keeping their liver healthy. So on this occasion of World Liver Day, I wish all of you stay healthy, keep your liver healthy, and all the best.
Thank you so much.